So without further ado, I'm going to introduce our two guests. We have Sarah from BH Care, who is going to give us the lowdown with mental health with the general public. And I have Beverly from the South Central Agency on Aging, who's going to talk about seniors. And Beverly, why don't we start with you? You can introduce yourself. That would be great.
I'm Bev Kidder. I'm the Vice President of Programming, Community Program at the Agency on Aging of South Central Connecticut. Our office is located in North Haven. We cover a 20-town district, including all of the towns in your region, in the lower Naugatuck Valley part of the towns there. And we go up to Meriden, Wallingford. Some of you know us from our programs out of the North Haven office. Others of you know us through our home care program. Home care not only covers the 20 town region I just mentioned, but an additional 20 towns that takes us out to the east section of New London, Norwich, in the area of the casino that we were speaking about so lovingly a little while ago. We cover the towns up there for the home care program. So that's me. Not much to talk about me. But
we're all a lot, let me tell you. Sarah, why don't you introduce yourself?
Hi, I'm Sarah Magistro. I'm the clinical site director for BH Care, our Shoreline location, which is located in Branford. We cover the towns we just talked about. So East Haven, Branford, Guilford, Madison, North Branford, and North Haven. We provide community mental health and substance use disorder services for people living in those towns, and really anybody who can get here, so they don't necessarily have to live in these towns to get services with us. And we also we provide clinical services, medication assisted treatment, prescribing other medications as well. We also provide wraparound services, so services like vocational counseling, social rehab, case management services, and housing services as well. We have a few different residential programs here in Branford, a supportive housing program, as well as a group home.
Fabulous. So Beverly, I'm going to start with you and talk about what mental health symptoms do you think people have been having that were brought upon or increased by the pandemic?
So let me put that in context a little bit in the 10 minutes that I have, because anything that I talk about and anything that we experienced this year, at least as it faces older adults, as it concerns older adults, is really nothing new. It's just what impact did being at home, did the pandemic have on people? So what some of the situations that we encountered, the conditions that were existing, was this social isolation that happened as a result of the social distancing. It was extremely difficult for older adults with social distancing because they were, as we were all advised to do, stay home, lock yourself inside, so to speak, and avoid the world. This is a very difficult time in life to give that message to individuals, because under just normal aging, it's a time in life that you're trying to normally encourage people to remain engaged, be active out in the community, find things that take you out of your home. Very different than, for instance, young and middle-aged people who are building families, and we're encouraging them, be in your home, be with your family, do family game night. Have older adults in the main, particularly those who are the clients of the Agency on Aging, tend to be alone in those houses. So we're always encouraging them to get out, and instead now we are saying to them, stay home, and not just stay home and have fun, but stay home and avoid the dangers of being out in public. The people that you meet and see could infect you, and you're at the highest risk of dying. So these really frightening messages, important, necessary messages, but the condition was one that encouraging the social distancing really led to terrible isolation for many people. Um, Not that they were more isolated, but they felt it more because they didn't have the escape to go out into the public. By being in the house and living alone and not having your neighbors and your friends in, and not having your grandchildren come over. Your grandchildren now are being painted as, little bombs that could blow up and spread germs on you. So that really magnified the fact of social isolation. Um, it didn't change the underlying fact that older adults, in a greater proportion than most folks, are isolated every single day, but the impact of it was greater. But one of the things that we observed, one of the conditions, was that the older adults have much smaller support systems in place. Due to aging, their friends die, spouses die, siblings die, they retire, they're not in the workplace with your colleagues at work. The folks around them in church start dying off because you tend to congregate with your age group. So they've got a smaller system to start with. Now, when you are isolated and told to stay in your house and you need help getting things, you have a much smaller group of people to draw upon to help you meet those needs. So that was another factor that was in existence. Thirdly, it is a time, but especially back March, April, May, for critical need for information. I got so sick of hearing people talk about being in uncharted waters, but they are uncharted waters. So in that time like that, you need as much information as you can get. And in our society, there was perhaps an information overload, but the method of delivering the information was almost all through technology. And unfortunately, it revealed the fact that the digital divide with older adults is enormous. And so you had important information targeted to the group of people who need it the most because they were the most vulnerable, but they didn't have ways to access it. Their access to technology, either they didn't have the hardware, they didn't have the internet, or they had it and didn't know how to use it. They maybe knew how to look at the pictures of their grandchildren on Facebook, but beyond that, the smartphone was smart, but the user was not. They didn't know what to do. You put that together with the fact that we have social determinants of health, which play a tremendous role in the lives and health of older adults in general. All of those pre-existing issues were there, such as housing, crowded housing, inadequate housing, transportation access for some individuals, education, racism, ageism, and overwhelming poverty. You have put all those things together in the midst of a pandemic, and all the impact of all of those conditions, which we know lead to poor health outcomes in general, are greatly magnified, leading to even worse outcomes during the pandemic. So that was the state of the condition that was existing. The way it impacted folks, what we saw a lot of was a much higher rate of depression in older adults than they tend to have a higher rate, particularly an institutionalized older adult, but even a community dwelling elder has a higher rate of depression than the average younger person. However, during the pandemic, that was even higher than it normally is. And anecdotally, the people calling into our agency experienced higher rates, but also in the early studies that have been done, but in a more scientific way than just our anecdotal observations, people are observing a higher rate of depression. There was something that I don't really understand, but there was a sort of disorientation that happened for an awful lot of folks, older folks. And people have called it a COVID fog. I assumed when I first started hearing about the COVID fog and observed it in people, that it was happening to people who had the disease, and something about the disease was affecting the brain functioning. I don't know as I believe that anymore, because I've talked to so many people who describe it in themselves, and I observe the behavior in so many people who've never had the disease. But I don't know if it's the overload of information, the uncertainty in society, but something is setting people off their normal pace. And we're seeing it much more in older adults than in middle-aged individuals. So that this just kind of lack of sharpness that they would have had before, acuity, uh, the boundaries not so clear, kind of confusion, difficulty putting their thoughts together. Is this a factor of depression, secondary to having had the COVID experience? Is it directly from the COVID experience? I have absolutely no idea, but it is something that we observed, this kind of fog. There is an increased sense of loneliness. So not everybody who's social isolated is lonely. Many people are isolated for the last 10 years of their life, and they don't experience loneliness. They figure out how to work their life. But during COVID, we find that that's a very, very big complaint of people. People would call us up at the agency and say they were calling because they were lonely. They need someone to talk to. That's something that prior to COVID, we didn't get those calls at our agency. We're not a mental health agency. We're, human services, but no specialty in the main in mental health. We observed a much heightened state of anxiety in people. Our average call from someone who calls us for information is normally 8 minutes. People call us, they ask us a question, we give them an answer, give them a resource, and unless they need follow-up, that's it. Our average call went up to 22 minutes since COVID, and it was really more than that in the first 2 months. It's down to an average of 22 now because it's starting to get shorter again, thank goodness. But the reason it was so long is people were so anxious that before we could get to providing them information about their question, we had to deal with their fears and anxieties. They were so frightened of the unknown, what's going to happen, frightened of the imagined, what's going to happen. I'm going to get the disease. I'm never going to see my family, those kind of thoughts. There was a tremendous amount of ruminating, being home, being alone, having all this time on their hands. That kind of mental process happened, and keeping the anxiety up. Tremendous sleep disturbance. That was one of the most common things that people said when they called us. We developed a policy that we screened everybody who called us for social isolation as part of a project that we had started working on totally separate prior to this, but we saw this as an opportunity. So we used this standardized, validated scale to screen people for social isolation. And in the process, we got a lot of information about people's other symptoms, and difficulty sleeping was just off the charts. Even people who are not socially isolated were complaining of they were unable to sleep. And I reflect back, I myself had a terrific disturbance in my sleep. So I could kind of get where they were coming from. The other thing we found, and I think this contributed a lot to the anxiety, we had a tremendous number of people who had an inability to meet their basic needs. And I'm talking about the most basic needs. By the end of the first week, we were getting, most of our calls were about, how do I get food? I can't get food. And either they had no way to go to the store, they didn't know how to use an internet app to order through like an Instacart kind of a system. They were on SNAP, and they were unable to use their EBT card. So they had money in the bank, but they couldn't get it. They didn't have anyone who could go shopping for them, and they didn't know what to do, and they were terrified. I'm not talking about, gee, I think I'll call the agency and see what's available. They were scared because they had no more food. Just the most basic kind of need. We also had a group of folks who need help live in the community independently with the assistance of someone to help them with some of their ADLs. And we experienced a labor force disruption with COVID. A lot of the healthcare workers tested positive, and so they weren't working. A lot of others were afraid of getting the disease and decided to stop working. And healthcare workers were deployed in more critical settings. So there just wasn't enough people to meet the needs of folks who were dependent on someone to help them bathe or set up their medications or basic things. And therefore, their ability to remain at home was compromised, and their fear of going to a place where they would get the disease was absolutely frightening to them. So, and then getting access to their medications, no one to go to the store for them. So the impact on folks was, in general, to see that there was a heightened sense of anxiety, depression for a lot of folks, extreme sense of loneliness, and this kind of disoriented fog. So it's been a very, very difficult year for older adults, secondary to the COVID issue.
Well, thank you so much. That was very eye-opening, especially for those of us who we have interactions with the seniors, but not as much as you. So Sarah.
So
What
we are
can-
definitely
There
seeing
you
some
go.
of the similar trends to what Beverly is talking about. A lot of the things that she's mentioned are things that I would have said something very similar. So I won't repeat everything. But I think one of the trends that we were definitely seeing is people seeking services for the first time. So people that had not been involved in mental health or substance use disorder treatments before, now needing to come in and to talk to somebody, that they were experiencing symptoms that they hadn't in the past, or things that they had been able to manage with the use of their social networks, community supports, and things like that. And since they didn't have those supports, they weren't available because so many things were canceled. They were now needing to seek professional help, whereas maybe before they got it from community meetings, church, other kind of social groups or connections that they had. So we definitely saw an increase in people coming in with depression, and people that already had depression having an increase in the depression they were already experiencing. Similar to what Beverly said, an increase with people with anxiety. Just all over the place. So definitely anxiety about COVID, but just anxiety in general, just a general fear of something bad is going to happen to me, or something bad is going to happen to my loved ones. Feeling like there really is that external locus of control, that I cannot control things that are going on around me. I can't keep myself safe. I can't keep other people safe. So kind of like an impending feeling of doom for quite a few people. Unfortunately, also seeing an increase in substance use disorders. Maybe people that had been using substances recreationally in the past, and that use increased during the pandemic for a variety of reasons. Again, sometimes not having that social support that they had in the past, kind of being isolated, stuck at home, definitely contributed to that. Also, a lot of people presenting with trauma symptoms. So again, trauma from the experience of going through COVID, but also an increase in symptoms related maybe to past traumas that somebody had experienced that now were being brought up again, or increased due to the fear and anxiety around the pandemic. So we often do see that when somebody has experienced one trauma or multiple traumas in the past, another one happening can really bring up those past feelings that maybe weren't dealt with, or didn't have really effective coping skills to manage, and now kind of bringing up those old feelings again. So not just the trauma of COVID, but now those feelings and fears about past traumas coming back as well. And I think with all of that comes a lot of somatic complaints. So people experiencing, physical ailments that maybe did not have a medical cause, upset stomachs, headaches, aches and pains, things like that are common when people are under a lot of stress. And sometimes there really is no medical cause. It is a psychiatric cause, and it is linked to that anxiety, depression, stress that people are experiencing. So kind of just to give you an idea of some of the increases that we've seen, in one study, pre-pandemic, it was estimated that about 1 in 10 adults was reporting depression. And in 2020, that number actually went up to 4 in 10 adults. So that's a pretty significant increase. And you have to remember too, that's just the number of people that are actually self-reporting depression. We still know there's a lot of stigma attached to mental health, so people may not even necessarily be honest about what they're experiencing, or may not even know that what they're experiencing is depression. They may kind of just, write it off. Oh, everyone's going through a tough time right now. So, that's just to be expected, and not really understanding that maybe what they're experiencing is something a little bit more than that. A lot of people, again, I think Beverly touched on this, but one study showed that an average of 36% of the population experiencing difficulty sleeping, 32% reporting some kind of eating disturbance, 12% reporting substance use disorders and again, these are people that hadn't necessarily experiencing these things in the past. And 12% were also reporting a worsening of chronic conditions. So things that they had been experiencing, but maybe now because of the pandemic and the stress that was causing, that those had increased. We do have some, so we treat people 18 and older here. So we do have some that are still in school. And Connecticut DPH study had shown that in the past year, 1 in 8 high school students had actually considered suicide. And that's a really significant number.
Wow.
And I think, Beverly, you touched on too, the digital divide and how this, comes into play for the elderly. I think it comes into play for other populations as well. Some people really just do not have access to the internet, to a smartphone, to a computer, to be able to access things. So while a lot of the community support did transition to a virtual platform over time, when we found out this was going to go on for longer than 2 weeks, places did try to accommodate. So things like AA meetings, church, other community groups, book clubs. I mean, really anything that people were doing before kind of tried to move to that virtual platform. But we know for some people that's just not doable. They don't have the technology, they don't have the ability, they don't have the funds to be able to purchase the necessary devices, or they're just not able to, even if they had it, they don't know how to do it. They've never had to do that before. So even though a lot of these things were made virtual, people still weren't able to access and utilize them. And I think for people that even felt more isolating, that there are these things now going on and I know about them and I can't even connect to them. So how awful is that? So we have definitely seen that as well. And even for people that are able to access these things virtually, there's such a difference between sitting in a room with somebody and engaging in anything versus doing it like this. I mean, there is just so much difference in that connection, and people are missing that social connection, that closeness, just being with other people. We are social creatures, and that has been taken away from us in a lot of ways.
Yeah, I personally agree with that on that level. But I do believe it is very, very, very age-based. I look at my son, who's a young man, he's only 29, and I think he enjoys this communication better because he can do it with 3 people at the same time on different, calls than he does face-to-face, one-on-one. And what we found with the older adults is the issue of access is a huge one. So many people just don't have the equipment or the knowledge. But even when we went out and bought the stuff for them and paid for a year of internet for them, they still didn't like it. So there's that, they couldn't make the connection. One of the things that we did with folks is try to refer them to this social isolation support program out of Quinnipiac University. They're doing some wonderful work there with that. And the older adults really, really enjoyed the support groups, but they didn't enjoy them on Zoom. They preferred to do them on the telephone because the telephone was a more familiar communication device for them. And so they were willing to do that, participate in the 6-week program and get a lot out of it. But they didn't enjoy it when we set them up on Zoom. And we even, did the setup for them so that you take away all the anxiety about clicking on. They didn't like it. So there is the whole technology issue. If as a society we're going to stay focused on doing things digitally and providing our information that way, we got to do a whole lot more.
Yeah, I would say that one of the things that the pandemic has shown me here at the health department is that, I mean, yes, there is a digital divide by age, but there's also a whole population of people, even younger than me, who are not comfortable on the computer.
Right.
And don't prefer the computer. And, their lives are living out in the real world. Yes, there's a big population of people who live on their computers. But there's also, I was shocked by, like, we would have these vaccination clinics for emergency workers, and a fireman who's 40 years old would come in and he'd say, I don't have an email address, or my wife has my email address. I don't have, and I'd be like, oh my goodness, like it, you don't know what you don't know.
Yeah. Well, previous to this era, we were always advocating for separate but equal, so target the younger folks with the social media stuff, but let us still use, the mail to write to people and so on. And I think what the pandemic showed me is those days are over. Nobody is going to give me the stamp budget to be sending out the number of letters. I mean, we sent out 3 times a day communication to people about the pandemic. Do you know how many tens of thousands of dollars that would have cost? Didn't cost us anything. We just hit the send button on Constant Comment, and that, we were able to do it. The government is not going to be providing information in other formats. The point, we've crossed that point. You either get on the train, or you miss the ride. So that is something that as an agency, we really have finally come to terms with. We have to stop being the force there that says, oh, but you don't forget the older adults. You've got to do it in pencil and paper. You've got to do it in person. We can't. We just have to keep moving on. And the challenge now, I try to think back. My grandmother, she was born before there was oleomargarine. And then oleomargarine was discovered, created, whatever the word is. And you got these little tablets and you made your margarine. And then we started, like, you could go to the store and buy it. Well, my grandmother still wanted my mother to make the margarine. At some point you say, no, we just go buy the Parquet off the shelf. We don't have to go always back to the roots. But for my grandmother, it was a big, big crisis because, my mother wouldn't make margarine anymore. Well, I think that the digital divide for us is everybody get on board, or you're not going to get the information. You're not going to get the access.
Right. So Sarah, what 3 things would you say that people could do to try to manage what's going on?
So I think we were talking about a lot of, there's been a lot of isolation. So any way that people can start to reach out and to reform relationships or get more social support. So I think it's common to drive down the street nowadays and see people sitting in their driveways, talking to neighbors that maybe didn't before. So trying to reach out and build new supports if you're not able to access the supports that you were using. I know that I've met neighbors on my street that I've never talked to before. And I live on a dead end street and my house number is 10. So that just gives you an idea of how small my street is. And there were still people on there I never talked to. So it is possible to build new relationships, and you might just need to get creative about it. Also, is there something that you really used to enjoy that you stopped doing because of the pandemic? And is there a way that you can reincorporate that into your life at all? Is there a modification that you can make to do that safely? Is there some other way that you can do that and bring pleasure back into your life in the ways that you used to before? And I would say the third is that it's okay to reach out and to ask for professional help as well. We are here, BH Care is here. There's lots of providers in the community that really want to offer assistance for people struggling right now. And there's no shame in reaching out and asking for help. And we're seeing a lot of people do it, again, that have not been involved in mental health or substance use treatment before. But you don't have to sit with this by yourself. You can reach out and you can get support.
To your second point, the trying to find a way to reincorporate things, I think a lot of working people who ended up working at home are overcommitted to their jobs, because now their jobs can get in touch with them 24 hours a day, 7 days a week. And I have a husband who's home, and he's been home since March 2020. And I've had to say to him, you need to stop letting them hold meetings at 7:30 a.m. because they never used to do this. But now suddenly this is a thing. They keep expanding how often they can be in touch with you. And so I'm trying to get people to talk to people about putting boundaries on and making time for what you need.
Yeah, absolutely. That definitely has been lost. I think with the pandemic, is that people are always available, because if you're working at home, you're always at work, right? There is not that natural divide between I'm walking out of the office, my work day is ending, and my family time, my personal time, whatever time is starting. That boundary has been significantly blurred. So definitely being able to set that boundary and doing your self-care. And I think it's important for people to recognize that self-care is not kind of what you need to do to get through life. It's what you're doing because it makes you feel good about yourself, or it gives you some kind of reward or some kind of pleasure. So self-care is not really sitting down and eating dinner. That's something you need to do to survive.
Right.
It has to be a pleasurable, fun activity, something that brings you joy or relaxation or whatever you feel like you're needing. That eating dinner uninterrupted by work is not really self-care.
Good point. So Beverly, what would you suggest for people?
Well, as I was saying, some of the conditions in COVID are not new to older adults. A lot of these things they've been living with, and they have strategies that have worked for them. With the hysteria, appropriately, the hysteria about COVID, I think there has been a tendency for them to forget, I know how to do this. You don't get to live to be 85, 95 years old without being resilient, without having faced your share of trauma over the life. Nobody gets through without facing burdens. But you can get frightened, and you need to remind yourself, other people need to remind you, you can do this. You've been through this, you lived through the TB epidemic, you lived through polio, you lived through these things. The country will figure out a way to handle it. You'll be sensible. You can get through COVID. You can get through anything. You can figure out how to be a widow. You can, all of those things that you've been doing anyway, now doing them in COVID seems harder, but you can take that step back. So I think as an agency, a lot of what we're trying to do is help people reflect back on their successes, their strengths, how they've managed in the past, and getting them to utilize some of those same strategies for managing their time during the pandemic. So that's one thing. The other thing is, I don't know if I'm right about this, but I'm old, so go ahead, tell me I'm wrong. I don't care. But I find for most of the folks that we work with, encouraging them to build structure. Um, if you're home all day and all night and all day and all night, it's just one long blur. And although most of our folks are not working at home, unlike you and I, um, they, without this, they had normal structure in their life previously. And now the pandemic took that structure away. So you need to create a new structure for the day. And we're encouraging people to actually write down your daily plans and commit to, when you're going to eat, when you're going to bathe, because people were saying, I'm not even putting my teeth in. I don't see anyone. What's the difference? I'm not even, and everybody had their list, lipstick, what's that? I can't, and getting people to put the structure in place, you're more likely to go to the window and look out and let people see you if you don't look like a disaster. So run a comb through your hair, that sort of thing. So trying to get people to structure their days, make some kind of behavioral commitment to that, remind themselves that they're resilient. And then I can't stress enough what Sarah said about getting help. We do a very small program, an evidence-based depression program designed for older adults who are homebound. So that's a very small group of people. And we average about 1 referral a month for that program. I've been doing it for 3 years. Between March and May, I got 45 referrals for that program that our staff identified people and referred them over. And that sort of thing is really important. I'm not looking to build that program by any means, but I was so impressed to see that people were recognizing, when given the opportunity to do so, that they did need some help. So that's one of the things. Normally, under usual circumstances, seniors are much slower to go get mental health services, to acknowledge because of the stigma that they might need help. But that was one of the things I found very helpful in the pandemic. There was so much talk about how things could affect people that it was a little less stigmatized to say, gosh, is there something that can help me, and accept it. So I would say accepting stuff, recognizing that people have strengths, building on those strengths, and encouraging people to be structured about their days.
Great. Now I'm going to open it up to questions. If people want to ask questions, we're just going to discuss from here.
I did want to speak to, Bev had mentioned about the disorientation that people are having at home. And I found that in the hospital, when people went from ICU to the regular floor, or they went from a hospital to long-term care facility, there is something called hospital psychosis.
Sure.
And I'm thinking, given what Bev said, is that maybe this is occurring too as almost like a homebound psychosis. Because when you're in ICU, like years ago, there were no clocks, there were no windows. So you were in a room, you didn't know if it was day, it was night, it was Monday, it was Tuesday, you had nothing. And that makes you disoriented. ICU is a little bit better now, depending on why you're there. So you don't see it as much. But when you see that transition from general hospital, long-term care, you will see a psychosis. It usually lasts about 3 days and clears on its own. But I'm wondering if now we have a new DSM diagnosis of homebound psychosis, where, one day runs into another because one day runs into another. And the other thing I found, because I do work a lot with seniors, I didn't see as many families engaged as I anticipated. We had seniors that were calling our senior center for grocery shopping. Take me grocery shopping, because our senior center had a program. And so then they explained to them that the senior center was closed. But you have an adult daughter, you have an adult son. Oh yeah, they told me to call the senior center. So I saw, some families not engaged when it would ordinarily be natural to be engaged and to take care of a parent. And then I saw senior centers who, I was open during the pandemic, but there's many senior centers that were closed.
Oh, almost all of them.
Right. And like the senior center in North Branford is still closed. And for some people, that was their only form of engagement, socialization, exercise, even a hot meal. They were able to make hot meals and deliver to home. I used Agency on Aging's Grocery and Meds program for the delivery of groceries. They're both wonderful things. Not enough. It's like a pant with one leg. You're happy to have it, but you're not completely covered. So I thought that was, they lost their family for a resource. They lost the senior center for resource. And who are we leaving alone? An elderly person has nothing. And to speak to the working at home thing, they have found that when you work from home, you work 14% more than when you work in the office. And I believe that to be true.
I agree. To your point about the surprise that the families were not more supportive, I will say in their defense, the message that we were giving to families is don't bring virus to your relatives. You're out in the world, you could be contagious. Your
Right.
parents are too vulnerable.
Right.
We got calls from people, from daughters in tears because they wanted to be helpful, were afraid of infecting their mother. She's home. Can the agency do something? Because I'm not supposed to go to her. And
Yeah, I'm not, you know
really
what? I've
difficult
heard that story from adult children. It's a great story. Doesn't do well with me because that adult child can go to a grocery store and drop them off on the front porch. That adult child can get on a computer and go to Instacart, Stop and Shop. That adult had resources that could have been utilized, that should have been utilized before making a phone call outside.
I think
family
in an
room.
ideal world, that's true. And I would say that for the vast majority of people, that is what happened. But
Yeah.
we have adult children who are in their 70s, of parents
Mhm.
who are in their 90s, and they're frightened themselves.
That makes more sense, but I'm talking about adult children who are like 40 years old. They were like 20 years younger than me.
Yep.
Um,
Yeah, there
sometimes you got to
definitely
step up
holes.
to that plate, and that would be helpful because the rest of us, our agencies that are going into the office, helping people, doing what we can. I think this year between like January and March, between the clinics and everything, we're lucky we're not dead. The phone rang 24, you're trying to help you, but you're looking for resources, things are getting shut down. And like you said, it's hard to communicate with people because some of these seniors don't have emails. To send a letter, sometimes the state and the feds were changing their guidelines so often that if you sent a letter on Monday and the post office being slow, the person didn't get the letter till Saturday, but the Thursday before, whatever you wrote about has since changed now. And so that was like another challenge of, dodgeball of information.
Exactly.
Karen?
We can't hear you, Karen. Can you
I'm
hear
so
about?
sorry. What was the question?
Karen Nemaya, she's trying to ask and we can't
Oh.
hear her. She's got her hand raised.
I thought you meant me.
Oh, sorry.
We can't hear you, Karen.
We see your hand up. Unmute
See you, we see
yourself.
you talk, but we can't hear you.
It's not working. She's got a new computer, she told me. Right?
You're that digital
Type it
divide.
on the chat box.
Why, put it in chat.
Put
Send
it in the chat, yeah.
Send it in chat.
I was gonna say that the statistic on sleep, I think, is way too low.
Yeah.
I don't know many people who haven't had, at least some disturbance in sleep. I think just about everybody. Any other questions? Well, this has been very informative. I've really enjoyed this discussion because a lot of us are going through the same thing, and sometimes it's just good to hear, obviously pandemic is never good news. And Karen says, I think we discount the power of in-person grocery delivery.
I
Yeah.
really agree. It's one of the things that I was most proud of during this is at our agency, we started a grocery shopping, grocery delivery program, and we paid for the $100 worth of groceries for folks. And we were able to get that up and running by the second week of the social distancing pandemic and the impact it's had on people. And the by September, we will have delivered food to 2,000 separate people
Wow.
and paid for that food with dollars that we went out and raised. So that was really, really an exciting thing to do. And people appreciated it so much that they were able to tell us what they needed, and we bought what they asked for as opposed to some pre-packaged thing. And we brought it to their house and we made sure that they got it, you know, and it actually got into the house.
Right. And Karen says that her mother loved interacting with the neighbor who delivered the groceries.
Right.
So I have a father-in-law who's 91, and his hobby is grocery shopping. So he has probably 5 different stores he goes to. He likes to make money by grocery shopping, so he buys everything that's on sale and tries to get money back. He never stopped through this whole pandemic. You know, we could warn him a million times, but it is what he does, and he never got COVID.
Thank God.
You know, yeah, thank goodness. And you know what? Good for him. But it kept him in his routine, right? Talked about having a routine and kept him doing something that he likes to do. And my husband would get frustrated. My parents have been gone for a long time. And I say to him, he's 91. You got to let him do what he wants to do. He's healthy enough to do this. You know what? Good for him.
Hey, Barb.
Yeah.
I was just wondering if there's any plan to create a document of lessons learned from this. You know, I think to myself that how lucky I am to hear all this, but where would one go for a central location to find out all of this information? So
Well,
maybe
this video is being recorded.
Mhm.
And it's going to go to all the libraries, and the libraries are going to put it out for people. And I've been taking notes and for this specific meeting, but I also have been documenting the pandemic from my desk, and I know a lot of other people have, and we've had a lot of invitations to meetings where people are talking about lessons learned
Oh,
and
tremendous.
that kind of thing, because you know that I don't know what's going to happen tomorrow. I don't have a crystal ball. I've had to live with, and I'm sure everybody else, that I kind of know what's going to happen the next few days.
Mhm.
And after that, things can turn upside down. You know, it might happen, but I have to be comfortable with the fact that I can't overplan or overthink things for too far in the future.
Yeah, sure,
That's
sure.
probably a really good life lesson.
Yes.
Or no.
Well, I was just thinking, you know, as a reference document, that wouldn't it be wonderful if, you know, collectively within the towns, that the people that have the information like you could get together and make a formatted document of lessons learned, you know, experiences, lessons learned, observations, and be able to share that with the public, because I hate to say this, but there's always a chance this can happen again. And of course, we do have the resilience, hopefully in the future, but we will have some efficacy. Wouldn't it be nice if there was a document that people could go to and say, okay, mental health services, this is what happened during the pandemic. Okay, grocery shopping, this is what happened during the pandemic. You know, here are your options, what you can do. I just think it might be very helpful.
Yeah, I often refer to the pandemic as this is a big trauma for everybody. Everybody think back to what they were doing during 9/11 and the 2
Mhm.
weeks after 9/11 and then the 2 years after 9/11. That was a community trauma. And I look at the pandemic in the same way, is it's a community trauma, right? We are never gonna forget this time. We're never gonna forget uh, what we were doing to cope. My husband eating, little box cereals of Fruit Loops and Lucky Charms, and it's just something he does, and that helps him through the day, you know. And it seems silly. It seems silly to me, but it's a comfort thing for him, and that's all right. I'll take that over, any harmful behaviors, outside of you know it taking the place of eggs and toast. but we all have to get through, and we're going to remember this time for what we did and how we got through it. He has helped out at some of our clinics, and he said, I did not want to get through this pandemic and say I didn't help people.
Mhm.
And my message to a lot of people who are struggling is find ways to help.
Mhm.
Reach out to the people who are isolated or who you haven't talked to in a while. And certainly the self-care thing that Sarah was talking about, I'm a huge fan of telling people about self-care, and that it's not, you need to be a little selfish with yourself and give yourself things that make you happy and make you comfortable so that you can move on, that you can help other people. I'll tell you this, that a lot of the volunteers that we have in our Medical Reserve Corps, we have been working at clinics since December, and some of them has said to me, well, the reason I'm doing this is my sister died last year from COVID.
Mhm.
And had she gotten COVID 2 months later, she probably could have gotten vaccinated, but the vaccines didn't exist then. And so I want to make sure the most people get vaccinated who get vaccinated. I know another woman who lost her spouse. People reaching out and helping has been their way of coping, and people, it's not a bad thing. It's not a bad thing to reach out to other people and help them.
I think, Barb, I think that, like you said, this is not over. But I think that the next two issues we're gonna be facing are the booster, which isn't gonna be so bad if we have it because we've mastered the clinics now. We got them coming in, going out, we're skilled at that. But the variant from India,
And
I
South
think
America.
it might be a whole different ballgame because I was in a meeting with Michael this morning and they're talking about that the vaccine may not be as effective to that variant.
I'm
We
trying
don't
again.
know.
Can you hear me now?
Hey, we can hear you now.
I am my own IT. First I had no sound, then I had no mic. Anyway, I can tell you all about how to adjust your own Zoom settings too. The problem we are faced with, and apologies if you guys talked about this before I had audio, is either people not showing for second doses or people just blowing off appointments altogether. So forget the booster and the variant. We're still in the here and now trying to get people covered. And, it's across all walks of life. So that's our
A lot
next
of
challenge.
sporting
So that
events now.
40% are vaccinated, but 60% are not.
Exactly. We're not, people are like, oh, we're herd immunity. No,
It
you're
ain't
not.
over.
No, you're
A
not.
lot of sporting events now are gonna be offering vaccine to people who come into the sporting events. I saw a picture in the New York Times of a booth where they're giving out vaccines and giving away a free marijuana joint to people who get vaccinated.
Oh my God.
Points for jabs.
What has the world come
Hey,
to?
the Super Bowl is having a raffle that if you can show that you're vaccinated, you're getting a free ticket to the Super Bowl.
Oh my
Yep.
God.
Yeah, through a
And next-
raffle. Yeah.
Next Thursday, there's a clinic in Old Saybrook and they're doing a cookout. They're giving people free hamburgers and hot dogs who come and get vaccinated at their
Mhm.
drive-through. You know, that's going to be incentivized. I think the best incentive to give people is we can get back closer to normal, or what, you know, it's not going to be what was ever, but you will have more freedom to do more things.
The two groups that I'm finding that are most hesitant are young females who are concerned, who have never had children, who are saying, well, if I get this vaccine, I don't know if there's going to be birth defects later down the road. And then young adults, you know, that 16 to, I know it's a big range here. I'm giving you 16 to 30, but
I think it's right, though.
yeah. So
Well,
we're
there's a
doing a
lot of
real big
faults in-
push at the high school.
Yeah, there's a lot of false information on the internet.
Yeah.
And where do they get most of their news?
Yeah.
On the internet.
Mhm.
And so we have to find ways to put out messages and to incentivize in a way that they're gonna get their vaccine. And you know what? I'm all for the colleges saying you have to be vaccinated to come to classes in person.
I couldn't go to school my whole life unless you got whatever the vaccinations
Right.
were, you know?
Yeah, absolutely.
Mom could not register for school until you had your proof of vaccination. And I can remember the TB test. They did them right there in the school. You had to have them. And
Yep.
we were able to eradicate polio pretty quickly, you know?
Yeah, but now people don't trust the government.
Yes.
Right.
And so I was gonna say, the political climate from March 2020 to May 2021 has been a whirlwind.
It's exhausting.
It is exhausting. And so it hasn't helped the trauma affected people, which is
I had a
everybody.
person who said to me they didn't want to get vaccinated because it was communism and we were microchipping them. And at this point, I am tired. I'm working like 60-hour work weeks. I capped out and I just said to the guy, you know what? The gauge on the needle's not that big. Don't worry about the microchip. Because I didn't know what else to say to him. I knew I was just, by this point, I was tired.
Right. In my head, I think if we wanted to microchip you, we would have already done it.
Yes, I know.
They already
Little
have it.
tired.
They already have it with cell phones.
Yeah,
Yeah.
that's right.
It's true.
So are there any more questions? Well, I want to thank Beverly and I want to thank Sarah. Thank you
Thank
so
you.
much.
Thank you
And
very
I will
much.
be now inviting you to our chipboard meetings to be
Yeah.
coming to all our meetings because it's fun. It's been a great discussion. I will be uploading this to have a video that's available for the libraries and for any agencies who want to share it. I think we'll be going back to this. I think we'll have another one of these mental health round, you know, community discussions is what I like to call them, in about 6 months. And we'll see where we are in
Yeah.
6 months. And it'll be fun to look back at the old one and say, we didn't know this was gonna happen.
Harper, where are you uploading it to besides the
So-
libraries?
I'm gonna upload it to YouTube
Okay,
because that's the easiest thing I know. I know to go on iMovies, I can create a title, I
Oh,
can do all that stuff and I can
great.
upload it.
and
And
then will
then
you
I'll share
throw
the
us
link. I'll share
Send
the
us-
link with everybody.
Thank
Oh,
you.
thank you.
Thank you.
So thank you,
Welcome.
everyone. Have a great day.
Nice to
Have
Stay
a great
well.
Yeah,
month.
nice to meet you all.
Happy Mother's
Well,
Day.
nice meeting you,
Happy
Pat.
Mother's Day, and if any of you
Thank
have
you.
anything going on at your agencies or with you in person or in your community, let me know and I'll share it. All right?
Thank you.
Thank you.
Okay,
Thank you.
bye-bye, everyone.